What is COPD? I'm having a hard time breathing that's been getting worse over a long time now. My doctor says it's COPD. What does that mean? COPD is chronic obstructive pulmonary disorder and covers several different issues. Now let's talk about it. Hello, welcome to Cardium. I'm Jason Moran, and today we're talking about chronic obstructive pulmonary disorder, or COPD for short. Now, COPD is an umbrella term that covers three main types of airway and breathing problems that cause constriction or reduction in airflow through the lungs. So let's start with a quick breakdown of the term. Chronic. This is an incurable and oftentimes progressive condition that will get significantly worse if not properly managed. Obstructive, the tightening or blocking of the airways in the lungs, and we're going to talk more about this in a second. Pulmonary, this just refers to the lungs and tells us where the condition lies. And then disorder, kind of self-explanatory, but basically things are not working at their best. So like I said a minute ago, COPD is an umbrella term for three main types of airway and breathing disorders. That's emphysema, chronic bronchitis, and non-reversible asthma. There is another type of asthma that is reversible, and oftentimes it's more allergen related or exercise induced and can be reversed with a simple inhaler or home nebulizer. That kind of asthma is not COPD. Now, asthma that activates while at rest or during certain times of day, like the morning or night, just a chronic condition that requires regular treatment, is the COPD asthma that we're talking about here. With non-reversible asthma, the airways become tighter because the inflammation and constriction cut down, making it more and more difficult for air to pass through. This tightened airway causes a whistling sound as air passes through it, giving that telltale musical wheezing sound. Oftentimes, typical asthma medications like inhalers are not enough to relieve this constriction. IV medications are often needed, like corticosteroids, in addition to nebulized breathing treatments. This combination helps to reduce the inflammation or swelling and reopen the airways. The next condition is emphysema. This causes an overstretching of the little alveoli sacs where the oxygen and carbon dioxide exchange takes place. If stretched too far, these little sacs lose their ability to stay open and end up collapsing down on themselves like little plastic bags. Once closed, air is unable to pass through them and oxygen no longer exchanges with carbon dioxide. These little bags trap old air inside and cause the lungs to become bigger due to the extra work they have to do. Bigger lungs are less efficient and breathing becomes harder. Many patients with emphysema require home oxygen at all times. These patients are sometimes referred to as pink puffers due to their appearance. The damaged alveoli creates an increased work of breathing as well as an increased rate of breathing. This helps in keeping the skin normally pink, but giving the appearance of puffing while trying to increase that oxygen exchange. Over time, this will cause muscle wasting and the patient will begin to appear sunken in. Chronic bronchitis is another inflammation of the airways similar to asthma, but tends to work in the larger airways, whereas asthma works in the smaller airways. With chronic bronchitis, these larger airways, called bronchioles, are lined with tiny little hairs called cilia. These hairs are the housekeepers of the lungs and sweep out impurities, mucus, or other irritants back out to the main airway, the trachea, and where we simply cough them out. Now, if these little cilia housekeepers get clogged with mucus or impurities, it causes the airways to become irritated. Because hey, who wants a dirty lung, right? So the cilia housekeepers are clogged, the airways are irritated, and what does the body do when it's irritated? It begins to swell. This swelling is the result of helper cells trying to unclog the cilia, but the result is difficulty breathing, cough, and shortness of breath. Oftentimes, these patients may be referred to as blue bloaters due to the lack of oxygen that's able to make it to the cells of the skin and the expansion of the chest wall from that work of breathing, giving them a bloated appearance. In most cases, These conditions are self-manageable. The first and most important thing is, if you smoke, stop. Stop immediately. You already know this, and I'll save you the lecture. If you're using home oxygen, please do not smoke. I've seen enough of that in my ER, and I really don't want to see it there too. Otherwise, follow your doctor's directions, stay consistent with your medications, and if you use an inhaler, be sure to always have a backup inhaler as well. Well, that's it for this video here at Cardium. If you found this helpful, be sure to like us and leave me a comment below. Also, please hit that subscribe button below for more great information. If you have any questions or want to see anything in future videos, let me know and I'll be happy to address it. Until next time, y'all take care of each other.